The private insurance industry in America is expensive and inefficient. Today I'm going to tell you why I believe it's time to reform this system and instead replace it with a government-sponsored, public, universal insurance option for patients. This is drastically important as this is an issue which is a hot-button political issue, and also as we all need health care and insurance, and these are major costs in most Americans' lives. I've educated myself deeply on this issue and studied other systems, their relative outcomes and costs, and I've also been on public health insurance myself for the past 6 years. Today I'm going to make the argument to you that we need better care, and I'm going to make that in 3 points. The first will be the financial basis, the second will be health outcomes, and the third will be a civic duty argument that I think you might find convincing. In terms of costs, the United States healthcare system is the most expensive in the world. In America, we spend over $3 trillion a year treating people for medical conditions and other issues. This averages out to over $11,000 per person spent on healthcare. And in terms of per person costs, that's about $11,000. The second highest per person costs in the world are in Switzerland, and that's $7,700. The average cost in the world per person is about $4,000 per year. And in Europe, which is more comparable to the United States with developed economies, it's about $5,000 a year, which means that we're paying more than twice as much as them. This cost isn't only in a gross term, it's also a cost that's given to patients. In a study for the Los Angeles Times, respondents in America said that 7.4% of families had to make a sacrifice financially to pay for medical services in the past year. Compared to countries in Europe, this was very high, as most countries in Europe, the rate was somewhere in the 1 to 2.5% range. In addition to this cost for care, there's also a much higher cost for prescriptions in America, often averaging twice as much as the cost for prescriptions in other countries. And what do we get for this care? In fact, we have some of the worst health outcomes in the world. Our expected age, according to the World Bank, is 78 years, which is shorter than most European countries, in which you can expect to live 82 to 83 years, which means that we're giving up 4 to 5 years in terms of our life expectancy based on our health system and other factors as well. This also shows up in terms of our disease burden. We have higher rates of diseases like musculoskeletal, cardiac diseases, and certain cancers which could be prevented by earlier healthcare. And we also have higher burdens of death from measles and diabetes, which are both diseases which can be treated more effectively when caught early and treated with preventative medicine. The truth is that preventative medicine makes a huge difference in terms of medical outcomes, and that not having access to preventative medicine or to early detection services costs many Americans better health outcomes, and this is mainly driven by financial concerns of those services being too expensive to afford. So not only are we getting underperforming care for our high outlay, but I also think that there's a civic duty argument to be made here. Even in America, there's an acceptance that on some level, health care is a basic universal human right. In 1965, our government instituted the Medicare and Medicaid programs. They're both public health insurance programs, and Medicare pays for elderly adults over 65 who are retired to have insurance, and Medicaid pays for select individuals who are financially unable to afford insurance and helps to subsidize their care. After this, in 1988, we passed the Emergency Medical Treatment and Labor Act, sorry about that. And this act said that it was illegal for hospitals to refuse care to patients based on age, sex, race, creed, religion, or financial ability to pay if they were receiving Medicare dollars. This means that since 1988, everybody who shows up in an emergency room will be treated regardless of whether or not they have insurance, and then they'll be left to figure it out later. In 2010, the biggest step towards this belief of a civic duty to provide health care for people was taken when we passed the Affordable Care Act, or Obamacare. This act extended Medicaid benefits. It also helped to give more people access to insurance by forbidding insurance companies from discriminating against patients based on pre-existing conditions, and also creating an individual mandate and government marketplaces that made it easier and also more necessary for patients to get insurance. But it didn't go all the way, and we still have private insurance markets. The truth is that in America, we have a unique situation in the industrialized world where somebody can be forced to go into bankruptcy because of their medical problems. And personally, I think that this is not a untenable solution for our healthcare system. And I also know that the system as it is, with all the insurance regulations from personal experience, is very complex and confusing and difficult to deal with, especially if you're a patient going through a medical issue. So, I've told you today why I think we need to have universal government-sponsored health insurance. I think that not only is it disappointing that we pay more than anybody, but we also get terrible outcomes. And I think that it's our civic duty that we try to remedy that by looking at a different way of solving the problem. I've told you why I believe that we need healthcare, and remember that this is important because this would help everybody by reducing costs overall and also giving everybody access to the care that they need. This is an incredibly hot topic in political debate, and it's also something that we all need to consider when thinking about our future. I hope that you'll agree with me that the most obvious solution and way to make our healthcare system better is to institute a universal government-sponsored health insurance program.